In this video, we will look at a clinical scenario that illustrates the potential impact of low data quality on patient outcomes. As you will see, this scenario also highlights potential system, process and human factor issues that can affect capture, entry and use of quality data.
Terry is well known to hospital staff. He is an elderly gentleman who has complex chronic health issues with frequent hospital admissions. On this occasion, Terry has been admitted following a fall, resulting in a fractured neck of femur. He has had surgery and a significant length of stay. In total, 8 weeks from admission through to rehabilitation and finally discharge back to his home. Relevant to this case example is the New South Wales Health Nutrition Care Policy, which requires that all patients have their weight measured on admission and weekly thereafter. Accurate weight data is essential for monitoring nutritional status, particularly for those who are frail, ill, or suffering from injury. In Terry's case, he was all of the above. Unfortunately, in Terry's case, a number of data collection and data handling errors transpired during his stay. During Terry's admission process, his weight was recorded in multiple places on paper charts. The values varied, which was problematic for the medical team member entering the information into the electronic record. He attempted to establish the relevant value, the source of the truth. The weight measure was a mandatory field, also known as a force function, so a value had to be entered to enable the clinician to continue. The most likely value was entered. During a weekly weights round on the orthopaedic ward, Terry was being seen by the occupational therapist, meaning that staff could not take Terry's measure. Unfortunately, following staff handover, the routine measure was forgotten, meaning that a weight measure was omitted for that week. He was transferred to the rehabilitation facility where staff continued to measure and record his weight on a weekly basis, as per the policy. Here's where a couple of additional issues came into play. The 3 sets of scales available in the rehabilitation unit were poorly calibrated and returned significant variations in measures. Staff were diligent in conducting and entering weight measures. However, they didn't understand their potential significance or recognise the radical drop in Terry's weight across his stay as a sign of nutritional risk. What all of this meant for Terry was that his weight loss was not identified as a matter of concern. If reliable quality data was available and that data was interpreted and acted upon appropriately, a dietetics referral for nutrition assessment and intervention would have been initiated. Due to the multiple issues impacting the recording of accurate weight data, Terry returned to his home malnourished and weak, placing him at greater risk of infection, dehydration and falls. Regrettably, it wasn't long before Terry was readmitted to the hospital, this time with a pressure sore, another known consequence of poor nutrition.
As we've seen from this case scenario, there are multiple human factors, systems and processes that can potentially impact the quality of health data. Terry's case provides insight into the possible downstream effects of health data, including how data quality can impact patient safety and healthcare outcomes, clinical workflows and decision-making, and services planning and resource management.